Diolch, Chair, and prynawn our conference. It's so good to be here in person after such a long time, and I'm really pleased to be able to respond to this debate. Our care system has been battered and bruised by the pandemic. Just like the NHS, it has highlighted the incredible courage and dedication of the huge and the diverse workforce. The demands on our care services are unrelenting, and we've heard about that today. And there is so much work to be done to protect, rebuild, and develop our care services so that they deliver for all who need them and all who work in them. Conference, the motion, I'm pleased to say we are very pleased to support it, discusses our route to the development of a national care service for Wales. And we've heard today how important that this journey will be for those that rely on these services, for those that work in them, and for our wider health and care system. At the last Senedd election a year ago in May, we stood on Welsh Labour commitments to invest in our social care workforce, improve the quality of our provision, and over time rebalance our services towards local authority and social enterprise providers. Conference, on rebalancing, we've made good progress in making clear to the children's residential home sector that we will eliminate profit from this service. We aim to legislate, if necessary, to ensure that care is motivated by children's needs and not by the balance sheet. We will work with the residential sector to help move it back to the local authorities or to a more social enterprise, cooperative ethos and ownership. Our work to deliver a national care service is moving forward. We're in the process of designing and introducing a national framework for care and support. The framework will set standards for commissioning, set out codes of practice, reduce complexity, and rebalance commissioning to focus on quality and outcomes. Conference, it will ensure that what matters most to people sits at its very core. We will also establish a national office to oversee the implementation of the national framework across Wales that will create a fairer and more consistent service structure across Wales. But as ever, it is local partnerships working together with their communities that will deliver the service needed to meet the needs of their population, because we want the services to be absolutely embedded in local communities. And, Conference, we must cherish and nurture the local partnerships forged during the crisis of the pandemic that has been forged between communities, service providers and local authorities that came together to ensure that people were looked after as best we could. And despite the real risks to health, despite hardships, our care workforce did its best to support those most vulnerable across our communities, giving them dignity and respect, as was referred to in the debate. Sadly, we lost many people to COVID, and many of them disabled people, as we also heard in the debate. But across the social care and health service, we also saved many too, and kept hope going in these most challenging of times. The sacrifice and commitment to local people, to families and to communities by our social care and health workforce will always stand as a testament to their special character and quality. And I am proud that our Welsh Labour government will in a few short weeks have delivered on our manifesto commitment to pay the real living wage to social care workers at a cost of £43 million. And I'd like to say that we do see this just as a start to a move to better pay, better terms and conditions, because we know it is not acceptable what those terms and conditions and pay is at the moment. We've also set up an additional payment scheme for registered social care staff aligned to the real living wage, and those eligible will receive around £1,000 in their pockets from April. This is recognising the important profession that this is. And you have to register in domiciliary care, and you have to register in adult care services and children's services, and we're recognising that professionalisation by this £1,000 and by moving to the real living wage. And I hope this will demonstrate our commitment to make further improvement to the terms and conditions of social care jobs and develop an improved career structure. And conference, we're delivering on our manifesto commitment to strengthen our regional partnerships between local government, health and the independent sectors so that they can together rebuild our battered services and ensure good integrated services in our local communities. We're helping them plan better together, engage better with their communities and commission better quality services. Because as Elin said when she spoke, you know, health and social care are absolutely bound up together. And if we haven't got social care right, we won't get health right. And so we have got to work together to ensure that this happens. But conference, we do recognise that this is at the start of our long journey to a national care service free at the point of need. And this is why we've asked an expert group to provide recommendations by May on practical steps which can be taken towards a national care service for Wales. And I will consult widely on those recommendations, and that will include our partners in local government, unions, the workforce, providers, and of course service users and their families. And we want to hear the voice of service users in this consultation. And on this journey to a national care service, we'll continue to seek the views of the Social Care Fair Work Forum, which has helped us enormously already in delivering the real living wage. They recommended how and when we should do it. And we will move towards parity of recognition and reward for social care and health workers. And in all this activity and ambition, of course, our core purpose is to serve the children, families and adults in Wales who are vulnerable in some way, as we all can be at some points in our lives. I think we will all need the services of our national social care at some point in our lives. And we know we've suffered unfair cuts to our public expenditure, as well as the trauma of COVID, and there's a huge job of rebuilding ahead. But the people, that we serve, they don't want slogans, they want solutions, and that is what Labour is providing. We may not have all the funding that we desperately need, but we do have our values, we have our commitment, our partnership with local government unions and providers, and we have our energy and belief in Wales. In short, we have solid foundations to create that national care service our people want and deserve. We will make it happen. And I think the person who's, the young man who spoke before me spoke so movingly about the commitment he gave to his father. And I want to say to him, we will make it happen. So finally, I look forward to returning next year and reporting on the progress that we've made in the development of our implementation plan. But I want to end by saying that this is something that I want all of you to be involved in. We will get recommendations from the expert group, but after that, I want to make sure that everybody who wants to be involved, who wants to give us their views, are able to do so. And then I hope conference next year, we will have made a real step forward to a national care service in Wales. Diolch yn fawr.
Okay, thank you everyone. Thank you, Julie, for that.